My name is Jonathan Jones. It's my pleasure, my privilege to be your host and moderator for this afternoon, this evening. Today is January the 11th, 2026. This is the second program that we have for the year. Last week was an amazing presentation. So many attended. When once again, it's not often that someone during their holiday season will take time off to dedicate time to their health. But this is well worth it. And I think that you'll be more than happy or very happy that you decided to join us here for this presentation. Our theme is an interesting one. The vision paradox, unlocking the science of eye health. That's what we have here on our slide presentation. But this is really just in honor of the fact that this month has been declared Glaucoma Awareness Month. Glaucoma Awareness Month. Later this month, we're going to be talking about Thyroid Awareness Month. So when you own the government, you can declare the month to be have as many awareness subjects or topics as you desire. But that's where we are right now. We're talking about glaucoma, and it's a pretty debilitating condition for some. And we'll talk a little bit about the statistics here in just a minute. But everything we're talking about is really based on the research and formulations of Dr. Prasad. And we are fortunate to have Dr. Prasad here with us, who will be able to tell us firsthand exactly what his observations, no pun intended, are on this matter of good vision health. So just be aware, though, that the FDA has not evaluated the statements that we're making. You're going to be hearing testimonials. They're purely anecdotal. That means results are atypical. And that simply means that what happens to one person may or may not happen to you. So neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any of the authorized representatives are making any claims that any supplements that we recommend will treat or cure any disease state. This presentation is for information and educational purposes only. It is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. So please keep that in mind as we go forward. You're going to be hearing some incredible things, and some of it, quite frankly, is hard to believe at times. And sometimes I pinch myself, when it comes to just seeing the results in so many different people. Just a few days ago, I got a phone call from a friend, and he said, I think I'm having a stroke. I said, well, hang up the phone and call 911. What are you doing talking to me? He says, I'm not doing that. I said, you're not going to go to the hospital? He says, no. Last time I went when I was having a stroke, it didn't go well. They didn't do much for me. They just watched me. He says, I think you might be able to help me. I said, I'm on my way. I just dropped what I was doing and I ran over. But before I left, you know what I grabbed, right? Nobody want to take a guess? You better believe it. I grabbed a bottle of Micro Daily. I grabbed one of Dr. Prasad's formulas.
EMF.
And I stayed there long enough. To see what that he could swallow it for himself. And he said his face was getting tight on his left side. I could see clearly he was having difficulty standing. I had clearly see that his hand was not working properly. I stayed there about an hour, maybe 2 hours, and I heard his speech improve myself. His wife said, after one dose. So this doesn't surprise me because I've seen it over and over and over again. And so he's doing quite well now. And but I was very surprised for him and her to tell me that when he had a stroke a year ago, that they did MRIs, CAT scans, x-rays. And he said that they found nothing. And they gave him no treatment. And the doctor said to him, this is according to him and his wife, the doctor said, I don't want to give you any medication for stroke because it could give you another stroke. That's what they both said, that the doctor said. I wasn't there. I don't know if it was true or not, but they both said it. And I believe that when at the mouth of two or more witnesses, the matter is established. So I believe that what they said was true. So that's unnerving to me. So that's why I believe it's important for all of us to educate ourselves on what our options are. You can lose your vision in a stroke. And we had an interesting testimonial about that last year. Maybe we'll get some updates on that, or someone will share their story today. In fact, today, if you have a story about how you've benefited from any of Dr. Prasad's formulas as respects to vision, we'd like to hear that at the appropriate time. But what is well, you can see that on our first slide that we're talking about glaucoma. And what glaucoma is a group of eye conditions that damage the optic nerve, and it often leads to irreversible blindness, frequently undetectable until significant damage has occurred, creating a tunnel vision effect that creeps in unnoticed. That's what glaucoma is. So the part about that should be sobering to everyone here is that it is frequently undetectable until significant damage has occurred. So that should make us all be aware that we should be doing something. We should be proactive now about our health because we don't want to find out when it's too late to do something about it. Be proactive about it right now. It's a serious condition. Those under 40 is not a huge population there, but you can see between 40 and 60, 3.8%. Between 60 and 80, the percentage is starting to get higher. And then those over 80, the percentage has gone up to 15.1%. So we're talking about a population of some 4.2 million that are currently living with glaucoma and 1.49 suffering from some level of vision impairment, 1.49 million suffering from some level of vision impairment. And the risk factors are just age and ethnicity, and of course, genetics can play a role. When the drainage system fails, in fact, you know what? I think what I'd like to do is it could be that Dr. Prasad can give us some insight on exactly, how this condition works. So let me go forward and introduce Dr. Prasad to our discussion, and then we're going to come back to these slides here and see if Dr. Prasad wants to give us some insight as to exactly how this condition works, rather than me telling you my version of it. So the micronutrient formulas that we recommend were all formulated by Dr. Kedar Prasad. And just to give you a brief snapshot of his accolades, this man was the world's first radiation biology Ph.D., the first in the world. He was former professor of the University of Colorado School of Medicine for some 30 years, and was also invited to be a member of the Nobel Peace Prize nominating committee for candidates in the category of medicine. Just wrap your mind around that. Out of all the people on the planet that they could have nominating somebody for this prize, he was selected. So this is not just your garden variety, professor. This man has world recognition. He's the author of 33 books. Got to update that. I think it's 35. And more than 250 peer review publications. And his work was funded by millions of dollars by the United States Congress. Millions of dollars they put behind him to do research to produce a formula that would keep the soldiers on the battlefield in optimal condition. And Dr. Prasad knocked it out the park. So we are the benefactors of his producing and being effective in making that formula. So I would like to just formally introduce you and bring into our discussion Dr. Prasad. So Dr. Prasad, thank you very much, sir, for joining us in this discussion. We really do appreciate when you bring your insights to bear for us.
Thank you, Jonathan. I always enjoy being with you and my engaged family. And I will be glad to contribute whatever I can to educate them how they can prevent it, how can they improve current treatment that they are getting. And so that should be a very interesting topic.
Okay. Well, very good. Well, thank you very much. Would you mind? I know you haven't seen these slides, and I apologize that I didn't get to send them to you in advance to make sure that you could see them. Sure. But can you tell us a little bit about, how this problem happens? The slide says that when the drainage system fails, what's going on here?
Yeah. Drainage, that's the main thing. Fluid is blocked. Drainage of fluid is blocked, so pressure built in, and the pressure becomes 21, 22, and finally, if you don't do anything, it can lead to blindness. But here is the main point. The retina portion of the eye is highly oxygenated. In other words, a lot of oxygen is present there. And you know, any place where there is a lot of oxygen, it will generate free radicals. When they generate free radicals, they will damage cell. And so this is very important to remember. So that's what happens. That if you don't do anything and if you are growing older, some people have more oxidative stress, some people less. But those people who have a higher level of oxidative stress, they start damaging various components of the eye, and then the drainage mechanism gets blocked, and then you have pressure, high pressure, and real
Okay.
variant, like he has mentioned it, is oxidative stress. And
Oh,
oxidative
okay.
stress occurs because the retina part of the brain is highly oxygenated, and nothing
Mm-hmm.
you take it is sufficient to routinely, like in a good diet is very important, but other kind of vitamin that you take it, they don't accumulate sufficient amount in the retina part of the eye. So they can reduce some, but not enough to prevent the glaucoma. And
I
so
see.
so the main
Now there is glutathione. There is glutathione in the eye, and I know that your formula has components in it that will raise glutathione in the eye. That helps some, right?
yeah, that's one. But the most important thing in the eye that prevents oxidation or reduces oxidative stress is astaxanthin that we have in eye formulation. There is no for other formulation which can as effectively protect the retina part of the oxygenation against as the
I
astaxanthin.
see.
And so
I
our
see. So
formula,
it has to do with the retina. That has to do with the retina part of the eye. I got you.
yeah, retina part of the eye, because this is the retina part of the eye is the damage starts. And then damage,
Okay.
if you have a lot of oxidative stress, they start damaging other part of the eye. And but they are the one culprit is the retina part of the eye, which normally has enormous amount of oxygen. Therefore, they are very sensitive in producing free radicals, and that can damage all parts of the eye. And so the question would be that there is no other accumulates enough except astaxanthin is the only pigment or antioxidant, you can call it, that our eye don't have it, and the eagle has it. When I was trying to develop this formulation of eye boost, I said lutein and zeaxanthin are two that our eyes have. But I said, the eagles see flying in the sky and then see on the ground some prey and pick it up. So I said, let us see what kind of pigment they have it that they can see from such a far distance. They found out they have not only lutein and zeaxanthin, but they have a third pigment called astaxanthin. Then it occurred
Mhm.
to me why astaxanthin is not in human. Well, maybe because of evolution, our food were very close by. You hunt and eat, so we lost it. And so then I did further research and found out that astaxanthin among zeaxanthin and lutein accumulates much, much more in the retina part of the eye than any place else. And then I look in toxicity, I say no toxicity. I said I will put that one in our for protection purpose. And so our is the only formulation which has astaxanthin in iBoost. And
That
so
is
yeah, astaxanthin. This is the secret weapon, really. And is and so and it's very interesting that Jonathan, you mentioned my wife has a genetic. The glaucoma could be acquired or could be genetic. And
mhm.
my wife has a genetic component, and her eye pressure was 20/21. And she went to the doctor. Doctor gave injection, drop, and this kind of stuff. So her thing drop out to 18. And she keep doing it is better than zero. And so
Yeah.
uh, then once I developed this formulation, he has started taking it. And within a month, her pressure dropped down, and she goes to the doctor every 4 months, and the pressure dropped down to 14th and 15th. So doctor was
Hmm.
shocked. I don't know what you are doing, but continue to do it. They never ask what you are taking. They said, continue to do it. Then my son inherited from his mother, Che, and had a pressure of like 18, 19, and she was not taking any medication on it, kind of treatment. So he said, Dad, can I try? I said, yeah, try it. There's no harm. He tried. His pressure without any treatment come down to 14 and 15.
Oh, wow.
Glaucoma, we know for sure, my own history, family history, even though it was genetic, not acquired, and
Right.
acquired would be equally effective. And so I think glaucoma, and as you know, I'm 91 over now, and I don't have any eye problem.
Wow. That's pretty impressive, Dr. Prasad. Well, we can see clearly that um, this angle that you decide to take with these three antioxidants,
Exactly.
specifically to build up the and improve the function of the retina,
Yeah.
that's
So protect
staggering, Dr.
retina.
Prasad.
Exactly.
So we're grateful that we have access to this. Now, you mentioned once before that there's a gut eye axis as well, not just the gut brain axis, it's the gut
Yeah.
eye
But
axis.
again, gut has become so important because they produce so many beneficial bacteria that helps all part of your body, all in all organs.
Mhm.
So the progression of glaucoma is not isolated to the eye. It is fueled by inflammation starting in the gut. Because anytime you have increased oxidative stress, you have inflammation.
Mhm.
Because what happens, if the oxidative stress or free radical causes damage to the cell, if the cell damage is not fully repaired, chronic inflammation sets in motion.
Mm.
They start producing additional free radicals. They start producing new toxic chemicals like pro-inflammatory cytokines. They're much more damaging. And
Mm.
so this is very, very important. And so gut, we have to make sure gut is very happy. And one way of the gut would be very happy, you use probiotics with prebiotics. And again, my wife taking all these things too. So, but she was taking beforehand, but it's not sufficient until you add eye boost.
Mhm.
You will
Mhm.
have no problem with the eye, and if you have a problem, it will improve markedly.
That is interesting. So, I just want to focus in on one part of what you just said there too, so that our audience can kind of keep up. You mentioned this um, the when the immune system is trying to solve a problem, the inflammation that it can cause, if
Yeah, further damage.
it can cause further damage to the immune system, can contribute to the problem.
Right.
So if it's responding insufficiently, is that what happens? Because it's sending out the signals that says come and help. And if
Yeah.
there's no response, that's what happens.
Yeah.
Okay.
So that's why the once you reduce oxidative stress, it also reduces inflammation simultaneously. Our formulation is such that you have to reduce both oxidative stress and inflammation at the
At the
same
same
time.
time.
And only one way you can do it if your formula increases both antioxidant enzymes and antioxidant compound that we take from the diet or supplement. If you do only one, then it's not going to be very effective. And our formulation, well tested in human, is the only formulation, micro daily, for example, which reduces both, which increases both antioxidant enzyme as well as antioxidant multiple compounds.
Wow.
You have to make
Okay.
a distinction. And but many agents will just do the one or the other. But
Hmm.
our is the only one. They can claim it, but we have a clinical data to support it.
And a patent that proves it too. So that's a beautiful thing. Now, this slide, Dr. Prasad, you told us this once before that 60 to 70% of beneficial bacteria is destroyed by stomach acid.
Yeah,
So you got around that
yeah,
by adding in
yeah,
bacteria that would survive the acid and the heat.
right. And those are two. One is Saccharomyces boulardii, another is Bacillus coagulans. These two have been tested individually in human, in adult, who are suffering from the intestinal inflammatory bowel syndrome and
Hmm.
have some benefit, not optimal, but some benefit. And so it is non-toxic, and that's the reason our formulation. No other formulation has these heat resistance and acid resistance probiotics. And the other one, like you mentioned, that the lactobacillus and bifido type of helpful bacteria, they get destroyed once you take orally. And that's why most of the commercial products are beneficial bacteria alone. They get destroyed, and very few of them survives to go to their home, which is a lower colon.
Hmm. Hmm. Getting to that lower colon, that's the key.
Yeah.
Um, to better health. So that's pretty amazing, Dr. Prasad. So you mentioned basically when it comes to actually we didn't talk much about omega-3 at all, but these four elements is what you mentioned as far as the eye is concerned. What is the role that the omega-3 play with
Omega-3 is essential, considered is essential fatty acid for your survival and growth. Is essential, and your body does not make it. So you have to rely purely outside. And the easiest would be the omega that we have to supplement it. And so, and very interesting thing is that omega-3 fatty acids, it is easily get oxidized by free radicals. So if your body has a high oxidative stress and you are not doing anything, omega-3 will be oxidized and become dysfunctional.
mm,
It is so important for brain and heart function, then you start having a problem. And so this is so important to have it. So if you have this functional omega-3, the only way you can make it a functional, you can reverse it. You
yeah,
supplement it so that it can replace it,
right.
this functional omega-3.
Wow. Wow. Okay. Well, that's fantastic, Dr. Prasad. So thank you for making that clear for us. And Dr. Prasad's omega-3 formula has the right balance of omega-3,
Right.
omega-6,
PSA, EPA, yeah.
EPA, the correct balance because
Yes.
we have so many. We get a lot of the omega-6
Yeah,
through
if
the
you
rest
get
of
too
our
much
diet.
omega-3, that's
Hmm.
inflammatory. So we have given it is essential, but give a
Hmm.
tiny amount.
Only a tiny amount of that's in there, but the vast majority of it is omega-3, and it's very beneficial to the body. So very interesting. So let's see if we have. I know we've got a couple of testimonials from people who
Sure.
have had some vision issues
Yeah.
that have benefited from your formulas. I still remember when you told us about your son. That was pretty remarkable, and your wife and your son.
Yeah.
That was remarkable, and it's always remarkable hearing about it again. But we also had one. I think it was Liz that shared a story with us about her niece with a stroke in the eye, and then of course Bob had an amazing story. So anyway, if someone is on the program now that would like to share your story, how you've benefited from the eye boost,
Hmm.
um, feel free to do that now. Just start waving your hand. Bernard got you warmed up earlier and said to start waving your hands. And if you think eye vision health is important, now we're going to press your button and say go ahead and let's hear what you've got to say, if there are any now. Otherwise, we'll pull up one or two of our testimonials. So Barbara Green has would like to share her story. So go ahead, Barbara. Let's hear your story.
Okay. I've been a recipient of Engage Global, Dr. Prasad, you and Dean and all of y'all for the last, oh, wait a minute. Can you hear me? Oh,
Yes,
I
yeah,
don't
we
want
can
to
hear you.
start my video.
Oh,
Oh
that's
man, I
okay.
guess y'all see me after all. Anyway, I've been taking it since 2023 of December. And when I first started, I had immediate results. When I got on the eye boost along with the other products, I got on the Core 4, I got on everything. I had an eye pressure of 18. When I went to the doctor, it went down. She told me you could get off of those eye drops because your pressure is back to normal. But what happened, I ran out and I didn't immediately get back on them. I went back to the doctor and she said, you got to get back on the drops. So Sunday, I had an accident to my eye. A plastic spoon broke and it went in my eyeball. And when I went to the doctor, she told me she couldn't even dilate my eyes because she couldn't see, and I could not see out of my left eye. So I'm
Wow.
out of my eye boost. I just ran out, so I can't wait till Monday morning to I usually call in and get mine so I could get back on my eye boost because it has definitely saved my vision. But I just have to stay on it. The not last week, but the week before that, I heard the guy say, "You got to be faithful. You got to take your regimen." So I haven't been doing that. Recently I have been, since he told me to do the omega-3. He told me to do two omega-3 and two CBD in the two in the morning and two in the afternoon. I started off good, then I slacked back, but after that I saw that the guy said that's how he was able to walk again, because I'm still suffering with the nerve that's dead in my left leg. My left foot is still paralyzed, but
Mm.
I am having some movements now. So my goal is to stick to the product. If I stick to the product, I'm sure. As a matter of fact, I know it's going to work because it has done it for me in the past.
No
And
doubt
I don't
about it.
suffer with any pain at all. I used to suffer with pain. I take the hydro in the morning and I take the micro daily at night. So I am a believer, Dr. Prasad, you have done it again. You're really helping us get a better quality of life.
Thank you.
Thank
Thank
you very much, Barbara.
And thank you all.
Wow, that's just that's beautiful, and always nice to hear these amazing stories. Bob Evans, you're going to give us an update on your situation or share with us what happened with you.
Yeah, yes. But anyway, good afternoon, all. Well, yes, I've been having some real good results with, of course, well, I'm on everything. I do everything. Of course, we know that the microdaily is the basis for everything is built on that. And so with the iBoost, I remember I was advised by you actually to use the iBoost. I didn't think I needed it because I figured that it's not going to help. Because I was resigned to what I had. I'd lost my vision through MS, and then it wasn't going to get better. The pressure was always high, in my eyes, and like running at 16 and all that. But since I started using the products, the iBoost, well, my numbers got lowered. Well, no, the last time I went to the doctor, they said it was at 10. So, well, 6 points down, right? So I'm happy with what is happening with iBoost. And to tell the truth, I mean, I don't faithfully take the eye drops that they give me. He's always advised me to take it because sometimes I forget about it. But then, I still am maintaining some good numbers with that. I, of course, what I also notice is that there is some improvement in my vision, because I'm seeing things, shapes of stuff that I wasn't able to see before. Light, I was always able to detect some light, but now things have gotten brighter. So it is indeed having an impact on my vision, and I'm happy for what it is doing. I really want to thank Dr. Prasad for his formulation because
Wow.
they were really working.
Thank you. Thank you very much, Bob, for the updates there. Beautiful.
Anytime.
Ed and Joyce Howard, go ahead.
We'll see if we can get a picture here. We're in Bolivia. 14,700 feet altitude.
Wow.
I just wanted to mention, really appreciate everybody.
He's up there on the top of Mount Everest. You just froze up on us there, Ed. So we're pausing here for a second, see if you unfreeze. But that's how it is when you get up there on Mount Everest, 14,700 feet elevation.
Yeah, I know.
It can happen at any time, right? All right,
Yeah,
we'll come back to you, Ed. All right. Go
yeah.
ahead, Bernard.
Jonathan, there's two things I want to bring out. First of all, my wife has gotten good results, and I mentioned it at the beginning, but also I've had some good results in that a lot of times I find that I don't have to wear glasses the way I used to. There was something that was said that I need everybody on here to understand, and there's something recently happened that was interesting. Sometime when people start feeling good, they start getting comfortable. A good example, last week I got a phone call of someone that's been with our product a year and a half. And this person, actually, the person that actually sponsored her as a customer wanted me to talk with her. Because what happened was over the last year and a half, she came in with third stage cancer. And now she's cancer free. And she says, I can't afford these. I'm coming off. And she literally stopped her order after being diagnosed as cancer free. And I was amazed because she had gotten down to just the regular dose. This wasn't a therapeutic dose, but this was just something that within $150, she can continue. As you get improvements with these products, a lot of people ask me the question, they say, well, how long do I have to take these products? And I always ask that question, well, how long do you want to live? And the
Yeah.
reason why I do that is because we eat every day. Why do we eat? To give our bodies the nutrients it needs. Why do we drink? To give our bodies the hydration it needs. With these, it's feeding the cells. Why would you stop something that your cells, it says, I'm so happy to get this. Thank you so much. Your help is so beautiful. Why would you stop something like that?
Yeah.
And it baffled me. It baffled me. So I have to say, I really appreciated what Barbara said, is that she ran out, she saw the difference, and now she's waiting to get it back and get it started. And sometimes when people do that, Jonathan, it's almost like your body's starting back over again, receiving micronutrients. Some people have to go back to therapeutic doses
That's
in order to
correct.
get back to where they are. So we have to be very, very careful that once we see these wonderful improvements, don't get comfortable and stop your regimen. And
Do
by the
not
way,
relax.
someone asked a question on there, Jonathan, that you may want to tackle while you are in it. And by the way, if anyone have eye experiences, I know a number of you on here, please don't be afraid to speak up, because this is for the sake of those that may have other people that need these experiences.
Thank you, Bernard. Appreciate your sharing that. And yeah, one of the questions that came up was, what is the correct amount that a person should take? So, Dr. Prasad, if a person, say, has a problem with their vision, should they take, how much of the eye boost should they take?
I boost, you start with one capsule in the morning, one in the evening. And if it doesn't improve within a month or two, then you take two. My wife and son takes one in the morning, one in the evening. I take the same way. And but if you, at maximum, I mean, it is non-toxic, so it does not interfere what you are taking in prescription or doctor recommended medication. And so I think at least you must have people who suppose can't afford very much, and or core 4, for example, and they have eye problem. At least you take a micro daily EMF and a probiotics and eye boost. At
Right.
least 3 of them, you must take it if
Right.
you want to improve your eye.
Understood.
So that's the minimum you can do it for your health and eye benefit.
Yeah, that is exactly what we would like to encourage. Here's what that would look like, folks. Is these 3 items would be the least that you would really want to take,
Yeah.
when it comes to improving your eye health. So target that. You just get back with the person who invited you to this discussion, and they can get you lined up. submitting an order and with being able to get it for the most reasonable price, because the company really is subsidizing our health. They really want us to do better, and they put it within reach of everybody that possibly can. So that's a beautiful thing. So Fulvia, you have a question or comment, please?
Hello, everyone.
Good
Hi.
evening.
I have testimony
Okay.
about my eyes.
Okay. Well,
For
we're
the
going to hear
last,
this.
hmm?
We want to hear this.
All
Yeah.
right. Yes, you do. For the last 2 years or so, I've been dealing with glaucoma and diabetic retinopathy.
Yes. Yeah.
So I had some high pressures, 57 and above sometimes.
Wow.
Wow.
I started out taking just 1 of the eye boosts daily. That didn't do nothing, not for me. Then I started getting injections in my eyes. Well, then it cut down to just one eye. Then it went from 6 weeks to every 8 weeks. Then it went from, you're going to do this for all the rest of your days, to maybe right now is maybe 5 or 6 more shots. You should be good. Well, I, on my own, I talked to Jeff first. And he had said to do it for, I don't remember how long, but it was 3 and 3. Well, I'm
what?
still doing 3 and 3
Eye boost?
eye boost
Okay.
twice a day. And glaucoma that was, like I said, 57 and above, it's now 16 and 17, or sometimes 15 and 16 in these eyes of mine. I'm going to keep taking these products. I take them all. I take them
Wow.
all. The only thing I do not take is a sleep boost. I sleep too good. So I
Okay.
don't take sleep boosts.
Wow.
But nobody can tell me that these products don't work, because they have
Yeah, I think
done
it's very
Wow.
important that it has no toxicity. So by increasing the
exactly.
dose, so you start with, like I said, with 1, but then increase with 2, and then it doesn't work like you did. Go to 3. It has no
Mhm.
toxicity whatsoever.
Wow. That's
Yes,
amazing. Fulvia, thank you very
yes,
much. You are a
um,
walking
yes.
billboard for
Still
Engage
have,
Global
like,
and Dr.
the only
Prasad.
things that really still bothers me is lighting sensitivity and not the pressure, but I still have like fluid and swelling in back of both eyes,
Mm-hmm.
which has diminished a lot. Is what every time I go,
Yeah.
they run those tests, scanning the eyes and all that, and it's getting less and less. So why
Good.
would I stop? Can't
Yeah.
stop, won't stop.
Okay.
That's beautiful. Thank you so much, Fulvia.
You're welcome.
That is amazing. So once again, Dr. Prasad, knocking it out the park. That's a dramatic one there.
That's amazing. I never
Pressure
heard
at
of somebody
57.
can get that high, 57.
I did not know that the pressure could go that high and you still have anything left of your vision. So that's pretty amazing. Melvin Morris has a comment. If you want to turn on your video, Melvin, feel free to do so. Or whoever there is at Melvin's residence. Go ahead, please.
Jonathan and Dr. Prasad.
Yeah.
I'm on my second bottle of eye boost. And I'm 76 years old. I don't wear glasses. And on my phone and my tablet, you know how small the writing is. I can read everything from my phone and tablet. One day I was sitting on the patio looking at my phone, and someone was walking by. They said, "What are you doing?" I said, "I'm reading off of my phone." He said, "You don't have glasses on." I said, "No, I don't have glasses." The eye boost micro daily has really helped me. And this here, I have something to say, not about the vision, about my hearing. When I first came on here, I told everyone how I had fell. I did not know my hearing was as bad as it was. My television used to be up to 15. It is down to 5. Micro
Wow.
daily, Dr. Prasad, it has really helped me. And I'm on my second bottle of the iBoots.
Wow. That's impressive. Thank you very much, Melvin, for sharing your story. There we go again, Dr. Prasad. There we go. Charlie Rayford.
Well, mine is a little different. Hello to everybody, and thank you so much for all that you do for everyone, Dr. Prasad. I'm a little bit late getting here because some people called me with a big problem, and I was dealing with that at around 5 o'clock, so I couldn't get on in time. But your products are going out just faster than I can get them in Ecuador. But I had I have a person in the States, and he became legally blind. The doctor said he had a stroke. He says he doesn't remember having it, so it was a mild stroke, but it took his eyesight. He woke up one day and he says he couldn't see, and uh, it's been a while now, and he still can't see. So, what would you recommend?
I would say that, core 4 is a must, and then brain boost and eye boost. Those two additional.
Okay.
Yeah,
Thank you.
and if he had a stroke, we've had a couple of folks that have benefited from at least a dose and a half, maybe 2 doses. And Jeff's father, after his stroke, he went on therapeutic doses of microdaily and flooded his body with antioxidants. And his 91-year-old father, I think, got great results. So you can't go wrong, Charlie, with just getting with the large amounts of microdaily.
But I don't recommend for a long time, but short time.
It's just to try to help him get the benefit.
And the heart boost is very, very important. And if you have some anxiety, for example, for whatever reasons, or depression, then I will also add CBD. 2 capsules in the morning, 2 in the evening.
Okay, so in the therapeutic doses.
Well, I think, again, for short term, I would recommend, but generally I don't recommend for prevention purpose. But if suppose if by itself is not working at all, then you can increase maybe double the dose. But therapeutic dose is very, very high. And but if you take say therapeutic dose once in the morning, 1 in the evening, rather than like we recommend 3 times, that is for short time, for a few days, it will be okay.
Okay.
But I'm concerned that for long term, for cancer people, there is nothing to lose. But for a normal person like this, but if it has produced benefit, that by increasing the dose, that I wouldn't say don't take it. I would say continue today, a few more days, and then gradually decrease it to a preventive dose.
Okay. Thank you all.
I think that's the only point there, Charlie, was that some did it temporarily and they got really good results with it. So let us know how it goes. All right.
I sure will.
There is no short term and there is no harm.
Yeah.
Okay. Thank y'all so very much.
No, thank you. Elizabeth Rojas.
Hi, Jonathan. How are you? Hi, Dr. Prasad. How are you?
Very good. Welcome.
So, eye boost. For many, many, many years, I wore eyeglasses. When I went to the get my my license, it said it. I had to wear my eyeglasses. About the last time, 8 years ago, actually not even years ago, maybe about 4 years ago, I went to get get my license renewed, my driver's license renewed, and I'm not realizing it. I read the chart, no problem without my with my glasses. Came home, my license doesn't say I have to wear eyeglasses any longer. I have been taking the eye boost for all these years. I could not see for the longest. I always needed my glasses because I could not see from a distance. And when I was driving, I couldn't see the signs. I couldn't make out the letters. I couldn't make out the signs, especially at nighttime, was when I had the biggest problem. I stopped driving for a couple of years now. And about 2 months ago, I had to drive to the airport to pick up my daughter about 11 o'clock at night. And I could not believe how clearly my vision was. I was able to read every single sign from a distance. That's how wonderful the eye boost is. I take it every day. And what I do is I do it with a smoothie. And I also notice one thing which is very, very important because I think we don't realize this. I have a sweet tooth for sweets. I notice that whenever I eat sweets, my vision gets blurry from the sugar.
Yep.
And so what I do is that whenever I eat sweets, especially in the holidays, I double up on the eye boost to my smoothie. I just add two of them, and that immediately clears up my vision. So I'm able to see all the fine line that I could not see before, and driving, no problem driving at night. It's a wonderful product every single day. You need to take, but you have to take it every single day.
Yes. Yes.
Nonstop.
Thank you. Thank you very much, Elizabeth. We appreciate that beautiful story. Wow, that's firsthand, Dr. Prasad. I mean, that's
Yeah, I mean, these are very, very, I never imagined in my dream even that it will produce such a wide benefit.
her life has been changed
I know.
as a result of that. Go ahead, Jeannie.
Okay, so there's a couple of things that have come to mind. I wanted to mention about anxiety that, well, first of all, and I've said this before, I've had several concussions. The worst one was about 44 years ago and in my 20s. And about anxiety with concussions, it can cause anger issues and a lot of anxiety. And when I went on so in March of this year, I went on a therapeutic dose. And what was interesting is my concussion symptoms improved, but my anxiety went down. And that was before I started the CBD. And I take a CBD and a sleep boost at night to sleep. And that really helps me sleep like a baby. But I just wanted to mention that about the micro daily. Now, about the eye boost, I take at least one in the morning, one in the evening. And when I can afford it, I like to up it. You know, I've had so many accidents that it's just taking a while to deal with everything that I've experienced. But one of the things, as somebody was talking, they said they're still bothered by bright lights. And I can happily say that used to be me. Bright lights used to really bother me. And now, not at all. And so that's been a huge improvement just in since last March. And also the last thing I wanted to share, I was doing the therapeutic dose for 3 months. And when I did the therapeutic dose, I decided to keep going because I've got so much to clean up and so much to repair. And I understand why Dr. Prasad says don't do it too long, because it caused an imbalance in my elimination system.
Right.
And so, you know, there's a reason why Dr. Prasad, but staying on it for 3 months, not a problem whatsoever. And you know, anyway, that's good for today.
Yeah, I mean, you know, nobody has done a clinical study for high dose for a long time, and therefore I'm just becoming overcautious. But in a reality, if it helps you, then okay. But suppose in 3 months you are feeling great, and then you said, well, okay, gradually I will go to preventive dose, normal dose. So you gradually, then you take a 2 instead of 3. Then after a week or 2, then you take a 1. Like
Instead of a dramatic,
that.
drastic drop off.
But suppose in that case you started feeling bad, that once you decreases, then you said, okay, I will go back to my 3 therapeutic dose. There's nothing
That's
wrong.
right.
Right. Well, actually, what I did is I slowly went down from a therapeutic dose, 9 3 times a day, to 8 7 6 3 times a day, and now I'm at a double dose.
Yeah,
And I actually like spreading it out over 3 times. It just works well for me.
yeah. So
That's
that's a
beautiful.
good idea.
Excellent, excellent. So thank you, Jeannie. Thank you very much for sharing your story and for giving us clarification on that, and for allowing Dr. Prasad to comment further on it. So that's very good.
It gives me so happiness. Then I can extend my lifespan for a year.
Well, I tell you, Dr. Prasad, and I think that's the reason why we want you to hear directly firsthand from people. Our recordings are good. You know, we have a lot of those. But when you hear it from people direct, and we're all hearing it for the first time, I mean, it's undeniable then.
I know.
None of this was rehearsed. Nobody was coached.
Nobody says anything.
Nobody's being paid to say anything. This is not AI. These are real people telling their stories.
Yeah.
You know, so you just can't be denied. But just so folks are aware of it, you can get the entire core 4. Dr. Prasad we didn't pull comments out of Dr. Prasad on the collagen peptide formula, but this is the core 4. This is the general core 4, and Engage Global again subsidizes it. So the price that you're seeing on the screen, I think it may be about $5 more than that now, but that's way below the retail price. I mean, below the wholesale price. That's about $50 below the wholesale price, below wholesale. So they really want you to try the product. So because you can get the core 4 below wholesale, you can add on the iBoost, and get $10 off of it if you go on subscription. Then you can add on the Omega 3 and get $15 off that when you add them on to the bundles and go on subscription. So the company really does want you to try the product. So we encourage you to do that. And to answer a couple of other questions that folks often ask when getting started on these products, they often will say, well, will it interfere with my other medication? You know, things like blood thinners and my heart medications, or my eye medication, or my this medication, or my that medication. Dr. Prasad has said it repeatedly. He proved to the government that there's no contraindications, that his formulas do not contraindicate with any known pharmaceutical drugs. So if somebody's concerned about that, then you separate it by about an hour, hour and a half, 2 hours if you want to play it safe. Keep it away if you're concerned about it. But Dr. Prasad has made it clear there's no contraindications. We see this as the food that's missing from our food. So that's where this is.
And also, this kind of strategy that we have can reduce the potential toxicity of some of the prescription drugs. As you know, many of the prescription drugs have always side effects. And most of the time, side effects are related to increased oxidative stress and inflammation. And so doing that, it not only has no interaction, but our product has a potential of reducing toxicity of medications that you take.
There you go, folks. I think that you just heard it from the maestro himself. So what you have now is a path to preservation. If you want to see, this picture to me is amazing. And can you believe, Dr. Prasad, that an AI created that picture? AI. That's not a real picture. That's created by AI. But look how brilliant it looks.
Yeah, I know.
So whatever the case, if you'd like to be able to maintain your vision, and as it says right here, Dr. Prasad has said, if you address oxidative stress, you're replicating nature's best defenses. Heal the gut, we can protect our vision from the silent thief. Change your relationship with your health.
Yep.
Do for yourself what medicine alone cannot do. So, and we encourage you folks, please, to walk. Get yourself moving, go do things, get out, because the more that you walk, then you're actually doing things for yourself that your body can heal. You're giving your body a great chance to heal naturally. So, Dr. Prasad, thank you very much again, sir, for your being willing to join us on a weekend like this, taking time out of your schedule with your family, time from your family to provide us with enlightenment that we need to hear, all backed by your science and research. So we're grateful for that. And for everyone who shared their story, thank you, thank you, thank you.
Yes, thank you.
Next week, we can look forward to, I believe it's Jeff Ashby is going to be doing Everyone Has a Story next week. So if you have people who want to hear some amazing testimonials, come back again next week. And then the week after that, we'll be talking about the thyroid. So you guys want to unmute, say goodbye to Dr. Prasad, feel free to do so. My team 650.
Good night, Dr.